Topping the news tonight, as officials of the Pan American Health Organization monitor the increase in COVID-19 cases, they're concerned about immunization shortfalls, especially among children. And as the start of a new school year approaches, Paho is urging parents to ensure their children are immunized, despite the fact that they won't likely be on school campuses in the coming weeks. Here's Jiminy DeSwain.
Annually, thousands of students head back in the classrooms in September, but COVID-19 has now forced them into a virtual setting. But immunizations are just as important as they were before, reminds country representative for the Pan American Health Organization, Dr. Esther de Gorvel.
Clearly, what we do not want to happen is that the essential public health services and essential services are interrupted as a result of the outbreak. During periods of lockdown, it is particularly challenging for parents to bring their children out for immunization, but it's absolutely essential that immunization activities continue so that we can keep coverage high and prevent the occurrence of outbreaks of other infectious diseases such as measles, rubella, and others.
While classes will resume for the fall semester on virtual platforms, Dr. de Gorvel reiterates that immunizations must be completed.
And it is the tradition as the school year starts that both young children and secondary school children are required to have their immunizations updated as necessary before starting school. And even though the arrangements for 2020-2021 school year may be somewhat different, unique, the requirement for immunization is still present and still absolutely necessary.
With more than 2,200 confirmed COVID-19 cases locally, many in the Bahamas and across the globe are hoping for a vaccine for COVID-19. Here's where things stand with trials.
There are some 6 vaccines that have progressed through the initial phases of evaluation and have progressed to what is described as phase 3 trials. Before a vaccine is brought to market and brought to use for the general public, there is a stringent requirement for evaluation of the performance of that vaccine. It starts with a phase 1 trial in which the researchers would look to ensure that the material being used to develop the vaccine actually elicits an immune response.
By the 3rd phase of testing, she says consideration is given for efficacy, safety, and if those measures pass in terms of patient reaction to the said drug versus a placebo, the next stage would be the regulation of the vaccine and for manufacturers to begin production. Jiminy DeSwain, ZNS Network News.